Hello everyone. So today I'm here to discuss about the patient safety points module wise. And we all know that patient safety is a very important domain which is tested in the MRCOG exam. So coming to the ANC module, that is the antenatal care module, the patient safety points are like we need to know about the high risk patients, those with certain medical conditions like diabetes, epilepsy, sickle cell disease, and these patients need to be booked in the consultant led unit, and they should be having more frequent visit to the hospital. We need to involve the MDT in their care, like diabetologist, and in epilepsy patients, neurologist, sickle cell disease, of course the hematologist and the sickle cell team needs to be involved in the patient's care. We also have to review the medications, like if she's on any teratogenic medication like angiotensin receptor blocker, ACE inhibitor. If sickle cell disease, she might be on hydroxyurea. So we need to offer stopping these medications after discussing with specialist and change to safer alternative. Then we also have to know when we need to prescribe the high dose of folic acid, that is 5 milligram. Then inquire about the patient's blood group, any reservation for blood transfusion. And if the patient is a Jehovah's Witness, we know she will not accept the blood products, so she has to sign the advance directive form. And all the healthcare professionals involved in her care should know that the patient is a Jehovah's Witness. Then, if the patient smokes, drinks alcohol, offer NHS stop smoking services, the stop alcohol services. We have to tell the patient that smoking even one cigarette is not beneficial, it's going to be harmful for her and her baby. And inquire about the BMI, then inquire about the mental health history in each antenatal visit. You have to ask the two woolly questions that whether she has been feeling low or depressed in the last 4 weeks, or whether she has lost interest in the things which she used to do before. Then coming to the issue of domestic violence, it can be as a hidden agenda in any station, like if the patient is repeatedly presenting to the emergency or A&E department, if she was referred to the radiologist for the anomaly scan and radiologist noticed many bruises on her abdomen while during the counseling, if the patient is not having eye-to-eye contact, she wants to finish the consultation as early as possible, she seems to be in a hurry, or she tells you that if the consultation is going to take too long, then her partner or husband who is waiting outside might get angry. So at that point, you need to ask that when your partner gets angry, what happens? What does he do? And also tell her that the bruise marks which I have noticed, is it from your partner? You have to be very straightforward in these stations. Ask the questions directly. Tell her, I'm asking these questions because I'm really worried about you and your baby, and domestic violence is very common in UK. And before that, of course, you have to take her into confidence. Tell her that you are going to maintain the confidentiality, and you have to involve the safeguarding team in such cases, and if needed, the police. Particularly if the safety of the children is at stake, then you have to breach the confidentiality and involve the police in her care, okay, in this case. Then coming to the maternal medicine module, so here we have to discuss about the medical condition and its effects on pregnancy and the effect of pregnancy on medical condition, and also need to discuss about the strategies to minimize the risk. Like if the patient is obese, the BMI is 30 or more, and there are also other risk factors which increases the risk of thrombosis, offer her low molecular weight heparin, the blood thinning agent. Also tell her about the simple measures which can reduce the risk of clots. These are keeping herself well hydrated, keeping herself as mobile as possible, okay? Then, in certain medical conditions like pulmonary hypertension and Eisenmenger syndrome, we need to discuss about the safety of continuation of pregnancy. Because in such cases, if the patient gets pregnant, there is increased risk of maternal mortality. And we have to be very open and honest about this complication and offer termination of pregnancy. And of course, in the end, it's going to be the patient's decision, but still, you have to tell her honestly that if she gets pregnant in these conditions, then this can be very risky for her life. And in antenatal care, maternal medicine, whenever indicated, we have to involve the MDT, like diabetes, involve the diabetologist, dietitian, epileptic patient, involve the neurologist, patient with renal condition, involve the nephrologist. Then we need to know about the medications, like when to offer the high dose of folic acid, 5 milligram, aspirin, and DVT prophylaxis. Then other module is teaching. So here, where it's very important to rule out pulling. We have to ask the junior that how is everything in the department, and is she happy being in the department, and we have to take her into confidence. Only then she is going to reveal to you if she is being bullied by any of the seniors. Yeah. And also, do not undermine your colleague. For example, if the colleague has not done any procedure correctly, then of course you have to point out the mistake. But like tell her, for example, if while repairing the episiotomy, the junior did not take the apex and the patient has been bleeding, then of course you need to tell your junior that this is not the correct way of repairing an episiotomy, and you have to show her about the correct way of suturing episiotomy on the dummy and pelvis. Yeah. And also in teaching stations, you have to rule out allergy. Simplest example is again episiotomy, where you have to rule out allergy to lignocaine. In pessary stations, rule out allergy to latex. And while teaching the junior, again, you need to tell that when we are examining the patient, we need to maintain her dignity and always ask the patient that I would like to examine you with your permission and in the presence of chaperone. Then involving seniors is also important, like when teaching about the second stage cesarean section or management of uterine inversion, we need to involve our consultant. Risk management is important. Writing the incident report when you are teaching your junior about shoulder dystocia. Then next module is core surgical skill module and the post-op care module. So here we have to follow the WHO safety surgical checklist, follow principles of enhanced recovery program. Then we need to know how to take the consent. It has to be informed, valid consent, and taken by someone who is doing that procedure or someone who is expert in taking the consent. Need to discuss about the pros and cons of the procedure, alternative procedures, make sure that the patient is mentally sound and capable of understanding the information given to her. Only then she can sign the consent. Okay, so you can even get the stations on consent taking in the exam. Then we have to discuss about the risk factors for surgery, like if the patient is undergoing laparoscopy, she's morbidly obese, she has multiple scars on her abdomen. So we need to discuss about the alternative routes like Palmer point entry technique and Hassan technique. Before any major surgical procedures, if the patient is a smoker, offer her and advise her to stop smoking. If she is on the contraceptive pills, we have to stop the pills at least 4 weeks before the procedure. And then again, if there is an intraoperative complication, then we need to call for help, like in cases of ureteric injury or bladder injury. We need to stop the procedure, involve the operation theater staff and coordinator, your anesthetist, call your consultant and urologist. Yeah. Coming to the sexual and reproductive health module. So here, if the patient has been diagnosed with STI, we need to refer her to the sexual health clinic. Partner notification is important. Treatment and completing the course of treatment is extremely important. So the patient and even her partner, whenever indicated, they need to complete the course of the antibiotics or the treatment given to them. Avoid intercourse until treatment course is finished. Discuss about test of cure also in cases of chlamydia or gonorrhea. Discuss about the safe sex practice, the double Dutch method, particularly in younger patient and teenage girls with multiple sexual partners. And discuss about the use of condoms, that it protects against the sexually transmitted infection. Coming to emergency contraception, we should know about the contraindications, if you're prescribing the ulipristal acetate, then you cannot prescribe if the patient is severely asthmatic and she's on steroids, and if she's on proton pump inhibitors, or if she's breastfeeding. And likewise, when you're offering the copper coil, rule out copper allergy, any active vaginal infection. I have already discussed these points in my previous audio clip as well. Then before taking any sexual history, it's very important to signpost. You have to tell the patient that I would like to ask you some very personal and intruding question. Is that okay? Then you ask about her sexual behavior and the multiple partners. And also inquire about and address about the high-risk behavior like sharing needles, recreational drugs, and multiple partners. So these are the important patient safety point which I have discussed in these modules of antenatal care, maternal medicine, teaching, surgical skill, and sexual health. So in my next audio, I will be discussing about patient safety points in other modules like early pregnancy, labor delivery, postpartum, gynae modules. Okay, so actually there are many safety issues to be addressed in each module, and I have just given the simple examples. So you will be able to remember it only when you're practicing cases with your study partner. So when you will practice any case, and when you speak and you talk, then you will be able to remember these patient safety points, and then it will be very spontaneous, because fluency comes with practice. So I will be posting my next audio as early as possible. In the meantime, keep practicing with your study partner, and all the best. Thanks for listening. Take care and goodbye.